An elderly man says, "Doctor, food comes back in my mouth hours after eating and my wife hears a gurgling sound in my neck. Which surgical condition does this point to?" This is Zenkers Diverticulum, also known as pharyngeal pouch. A 65-year-old man presents with dysphagia, regurgitation of undigested food, halitosis, and a gurgling swelling in the left side of the neck. This is a classic presentation of Zenkers Diverticulum. So why does this occur? It occurs due to the failure of cricopharyngeus relaxation during swallowing. This in turn leads to pressure rising in the pharynx and the mucosa herniates through a weak area called as Killian's dehiscence. This is a Pulsion pseudodiverticulum. The question now is, what is Killian's dehiscence? Killian's dehiscence lies between the thyropharyngeus and the cricopharyngeus of the inferior constrictor. And when the pouch enlarges, it usually appears in the left side of the neck. How is this condition diagnosed? Barium swallow is the investigation of choice with a lateral view which shows the classic posterior pouch. Treatment requires a cricopharyngeal myotomy and options include open diverticulectomy with myotomy, diverticular suspension and endoscopic procedure known as Dolman's procedure, where instead of removing the septum, the wall between the esophagus and the diverticulum is divided, converting both into a single column. So the steps involved in surgery are: a rigid endoscope is introduced, the septum between the esophagus and the diverticulum is identified, the septum is then divided using electrocautery or carbon dioxide laser or endoscopic stapler, and then a cricopharyngeal myotomy is performed. The advantages of this procedure are that no external neck incision is required, short hospital stay, minimal morbidity, and ideal for elderly patients. The complications include mediastinitis, bleeding, and recurrence. So if you remember just one thing, Zenkers Diverticulum is equal to Killian's dehiscence plus cricopharyngeal myotomy. The rest of the concepts will flow by themselves. For more such concepts made easy, follow the surgical mind.